Good morning, Angela.
Good morning, Dr. Robin Michaels. I'm going to give you a quick introduction to everyone, and then you can get started.
Sounds good. Am I screen sharing with you?
Um, right after I do the intro, we can screen share.
Got it.
Perfect. All right. Well, good morning, everyone. For those of you who were here yesterday, my name is Angela. I'm one of the NPHC hosts. I'm also a student from the University of Minnesota. And this morning, I have the pleasure of introducing Dr. Robin Michaels, an Associate Dean of Student Life and Academic Affairs at the University of Minnesota's Medical School on the Duluth campus. As an overseer of the Offices of Student Affairs and Admissions, Dr. Michaels is willing to teach us how to master our interviews today during today's session. Let's give a warm welcome to Dr. Michaels.
Thank you so much, Angela, for such a nice introduction. And thank you so much for inviting me to your session today. I'm really excited to be here. Before I get started, though, I do want to acknowledge my colleagues around the country who have contributed to the slide sets that you're going to see in this presentation today. So South Dakota, Michigan, Arizona, Colorado, we're all over the country. So I imagine you will be applying to programs all over the country. So we want to make sure that you are absolutely prepared. So I want to say at the very beginning here that if you are offered an interview by a school, you should feel really good about that. And you should congratulate yourself and celebrate. And I say that because I'll give you an example of the school where I am at, which is a medical school that has about 4,000 applicants per year for 65 seats in the class. You start out when you're applying one of 4,000 people. By the time you're offered an interview, you have about a 1 in 4 chance at our school of being offered a slot in the class. So you should feel really good about that, regardless of whether or not the outcome is the way you wanted it to turn out. So congratulate yourself, celebrate, but then the work begins, and we want you to be as prepared as possible for the next step, which is going to be the interview process. So first and foremost, I think it's important to point out that regardless of the type of school that you're trying to apply to, and I really appreciated the Pear Deck interview this morning because it gives me an idea of who we're talking to, but whether it's dentistry, nursing, medical school, graduate school, most schools require an interview. And the reason why they do that is because they want to add to their understanding of you as a person and find out things about you that maybe wouldn't come across in your paper copy application or your electronic file. But it's also a wonderful opportunity for you to understand the school and its programs. And I can't emphasize that enough. An interview is really a two-way street. For some of you, you might get only one offer when you're in an application cycle. And so you'll decide whether or not you want to go to that school. For others of you, you're going to get multiple offers, and you're going to be in that wonderful but maybe frustrating position of trying to pick which place you want to go. So what we're going to do today is just talk a little bit about what the school wants to see in you in an interview, and maybe some things that you might want to be looking at when you're interviewing at the school. So let's start with the school and what the school is looking at. And I'm going to take a medical twist to this because I'm in a medical school, but the same kinds of questions might apply if you're applying to, say, nursing or public health or dentistry. What the school is looking for is your interest in medicine or your interest in a particular profession. What is it that brings you to the school? They want to know about your journey towards medicine as a career. And this is your pathway to medicine. And this is tied in admissions with something we call holistic review, which means we want to know something about you as a person and your pathway into medical school. I can tell you that I did not come from privilege, and I worked all the way through college. I can also tell you that I never had a GPA of 4.0. And that's because I never had the luxury of time to have the time to study as much as I would have wanted to. So my journey to medicine was working, so I didn't have as many opportunities to maybe do some of our uh, service activities, and some of the other activities that you need to do for a professional program. We are going to look at you the same way. We want to know what your pathway is, and we have expectations of what we want to see from you, but we also appreciate that everyone has a different pathway in. We want to know about your motivation for your career. You know, what is it that drives you? What is your passion? We want to know that you understand the career that you're going into. And I'm just going to point out that this past year with COVID, and if you have been watching the news, you see just how difficult it's been on healthcare professionals. Do you understand not only the wonderful side of a career in medicine, for example, but do you understand the obligations and the difficulties as well? And finally, and this is sort of an institution-centric thing, but the institution wants to know what you're going to bring to them. And institutions are working very hard to be more diverse, to look at non-traditional students, to diversify their classes, to look at students who maybe have second careers. And so you are bringing something special to the institution as well. And so that's what they're going to be looking at. From a standpoint of you as a person, they're going to be assessing your interpersonal skills, your ability to talk to me in an interview. You are, how do you come across? Are you comfortable talking to me? We do understand that everybody is nervous, especially when they're in a high stakes interview. But are you able to converse with me, or are you looking at your feet the entire time? And trust me, we've had people that are so socially awkward that they have so much difficulty carrying on a conversation. It makes for a very difficult interview. So if you are an introvert and you do have some problems with interpersonal skills, practice before you have your interview. We look at maturity. What's been your pathway in life? What kinds of experiences have you had? And how does that reflect in the activities and the things that you've done prior to professional school? How do you relate to others? What kind of skill sets do you have in working with diverse populations? How do you handle stress? I can tell you that professional schools are very stressful. It isn't that the material is necessarily so hard in the curriculum. It's that there's volumes of it coming at you at once. So you want to make sure that you have an ability and you have skill sets and you have a support system for handling stress. You're going to be asked to formulate answers to questions, and maybe there'll be questions that are a bit controversial. Are you going to be able to defend your opinions on those questions? And finally, the interviewer is going to be inquiring about the content of your application. So anything that you put in your application is fair game. And what I tell people when I'm talking to them about a personal statement is that you never want to put anything in your application that you don't want somebody to look at and to perhaps ask questions of. So if there's something that you're very emotional about, maybe a loss of someone in your family, you might want to think twice about how you put that and how you integrate that into your application process. Okay, now the fun part is what you're looking for, right? So you're going to be grilling us on things too. You're going to be looking at our school because, quite frankly, you're going to invest a lot of money into going into a professional program. And that's just a reality. So you're going to want to gain information about the school, and you will probably have looked at our website and you'll get as much information from that. But sometimes there's more questions than answers on a website. So you will come in and say, hey, I saw that you have a program out in a rural community that's 9 months long. Tell me more about that. You want to know more about it and whether it's a good fit for you. You want to understand more fully what the school is going to offer you. You want to look at the learning environment. What is the curriculum like? Are you an active learner kind of person? Do you like small groups? Do you like lecture type setting? You're going to be looking at those things. Maybe you're interested in research. And I don't just mean bench research or translational research. I mean community-based research, public health research. What opportunities are available to you on that campus? Community service opportunities are really important to our students. We have a student-led clinic. And so What kinds of things are available to students and how many students participate in those? And finally, you might ask about available scholarships because of the cost of professional programs. And one thing I did not put in here, but I think is really important as well, is what's going on around the school. What kinds of things are out there in the surrounding community for me to do that are fun. I live in Duluth, Minnesota now, and it gets really cold up here, but it is a wonderful place for hiking and biking and swimming in Lake Superior. So there's lots of things to do, and you should be asking questions about, hey, what do people do to relax? All in all, though, and I think this is really key, you should be getting a feel during your interview and maybe a tour of a school of whether or not that school is a good fit for you. Do you feel like the climate is right? Were you asked questions that made you uncomfortable or made you think maybe that it wasn't a good fit for you? What are the kinds of things that the school emphasizes? In our particular campus, we emphasize rural and tribal community health. And so we have a very specific mission. So we're going to be looking at whether or not you meet that mission, but you should also be asking us how we go about fulfilling that mission. So ask yourself whether it's a good fit. So you want to be introspective, self-reflective after you have your interview. Okay, so that's the background on interviews. That's kind of the gestalt of the interview. I want to move now to the types of interviews. And before I say anything else, let me just encourage you, when you get offered an interview, to right then and there, ask the program what kind of interview they conduct. It is different. It just feels different doing an interview panel or a one-on-one interview or the multiple mini interviews that we'll talk about in a little bit. They're all quite different. And so you want to know how to prepare for it. You need to know what kind of interview you're going to have. So a one-on-one interview is sort of a more traditional type interview. You have an interviewer and the applicant usually in a room. It might be 30 or 60 minutes long, usually not more than an hour. And you usually have at least two interviews by two different people. The interview panel is probably less common, but it is something that you may come across in dental and medical schools. Usually the panel is not more than 2 or 3 people, and each person might take turns asking a question of you, but everyone is going to sit there and rate you on your answer to each question. I can tell you that when I applied to graduate school, I applied at one large institution that had 9 people on a panel. It was a little intimidating. I felt a little bit vulnerable in that interview. So that was something I wasn't expecting. So you want to, kind of do your homework on a program before you settle into preparing for it. Multiple mini interviews have become really common in medical schools and dental schools and probably other professional programs too. And I'm going to come back at the end and spend a little bit more time talking about MMIs, but basically what they are circuits or different stations that you move through, usually about 7 to 10 stations. Each has a scenario or something that you're going to be doing, usually with someone who's assessing you, and then you move to the next station at a particular time point. The multiple mini interviews have become very popular in part because it standardizes the questions that are asked, therefore reducing some of the bias that might happen in a one-on-one interview with everybody asking their own personal questions of you. Video interviews have become a little bit more common in the last couple of years thanks to COVID. The video interviews are usually kind of a one-way interview where you're sitting at your computer, you have a question that comes up, you're given a certain amount of time to read and think about the question, and then you can answer it, and it's recorded. So it's not an interactive session between you and somebody. It is actually just a one-way interview. And people have different opinions of whether or not they like that. Some people like the fact that they're not being asked any questions. They can just come up and formulate their answers. And of course, our lovely Zoom interviews we have conducted on our campus, in our schools. Both of our campuses actually in Minnesota have been doing virtual Zoom interviews. And of course, this is because of COVID and people's inability to travel. But the plus side is that it saves people a lot of money, and it makes the application process more accessible to more people, which we like. The downside is that you don't get to see the campus and you aren't really one-on-one with people. You have to make an effort to take tours at different times. So that's the only downside of it. Okay, now who's going to interview you? In most programs, it's faculty. That's a big part of the interviewers. In our case, in a medical school, it's clinical and basic science faculty that might ask you questions. But there are also students, and there are usually upper divisional students. So in a medical school that's 4 years long, it's usually third and fourth year students that interview. They are the ones who have the most knowledge of the process and procedure in the med school. And they also have a pretty good idea of who they would or would not want in their class. There are also some administrators that participate in the interview process, and community members. And so we're on our campus, we have members of community and tribal communities, and our clinical community, hospital community here that come in, and they're wonderful contributors. I'll just give you an example. We have a nurse who is one of our best interviewers because she knows exactly what she does or doesn't want to see in a future doctor. And she's been just an amazing person on our committee. So those are the kinds of people who you might encounter. So not necessarily doctors or researchers. And there's a difference in some programs between whether or not those interviewers have access to your full file, which would be called an open applicant file, or they are blinded to some of the information about you, which is a closed applicant file. More and more programs are moving towards a closed applicant file, meaning that they maybe don't know anything about your GPA or in the case of medicine, it's an MCAT or your MCAT score, so that they are not biased based on numeric types of things. They're looking at other qualities in you. And those are not necessarily different kinds of interviews. It's just the knowledge that the person has at different timing involved in your interview process. And then I mentioned that with one-on-one interviews, you often have interviewers that ask their own questions. And we've moved more towards lists of standardized questions in order to reduce some of the biases of different kinds of questions and difficulty of questions that people have during the interview process. Okay, so those are the kinds of interviews. So be sure to do your homework when you're checking on a program and ask about that. Okay, now you've got the interview, all the excitement, you're all excited. And now you're going to get ready to prepare for the interview. The first thing I want you to do is review what's in your application. Now, I know that might seem kind of strange. You wrote that information in there, but sometimes there are months in between when you wrote a personal statement or when you put your top 3 most important experiences in your life and you forget about it. And maybe other things have added into that. Maybe the paper was published and maybe something else happened. So make sure that you review what's in your application. You know what you wrote. You know what people are going to be reading. Be aware of the strengths and weaknesses of your application. I shared with you that I had to work when I was an undergraduate, so I didn't have as much time to do some of the community service, for example, before my application. So I would know what's in there, and maybe I'd have to defend that. Maybe someone would say, you only did X, Y, Z. Why didn't you do more? And I could defend that. So make sure you know what the strengths and weaknesses are of your application. And really think about anticipating questions that an interviewer might have. And I've put down here some of our standard probable questions just as a talking point for you. Why do you want to be a physician? Is not a question that is usually asked directly of you. Usually people will look at your application and say, oh, you were an EMT. What was it that you liked about being an EMT? Oh, you were a CNA, you were a nurse, nurse's assistant. What did you like about that? What did you like about working in an assisted living home? What didn't you like about that? And what they're doing is gathering the qualities and attributes of you and deciding whether or not that's a good fit for being a physician. So it's a roundabout, indirect way of asking you that question, but really that's what they're trying to get at. Why do you want to be a physician? What's your pathway to medicine? Maybe I want to know more about some of the challenges that you had. How have you informed yourself about a career in medicine? Back in the day, many years ago, there used to be people would say, oh, this person had 600 hours working in a hospital. So, they would actually look at the number of hours and they would attribute that to whether or not you knew anything about medicine. It's much harder to get into hospitals now to shadow and to do those kinds of experiences, as many of you know. And so now what we want to know is, how have you educated yourself, and how do you know, for your sake, with all that you're going to invest in a career in medicine, how do you know that this is the right fit for you? What have you done to explore that? What are your goals? How have you demonstrated leadership skills? You're going to lead teams, interprofessional teams in medicine. What have you done up to this point to prove your leadership skills? How have you demonstrated compassion and concern for others? And this is actually not trivial. Humanism and care and compassion are extremely important in medicine and in any of the health professions you might go into. And so how are you at relating to different people? How are you at understanding some of the challenges that people have and concern for others? And the last two are ones that I always ask. I want to know what you do for fun and relaxation. And that seems kind of strange and maybe off topic when we're doing an interview for a professional program. But as someone who deals with the student affairs side of things and well-being programs, I can tell you that you have to have a way to relax and take care of yourself. You will not always learn everything you need to. You will fail some things, and you might not, always be successful at what you're trying to do. You still need to be able to walk away from that. And as I heard this morning, as far as, just taking care of yourself, you need to go get something to eat. You need to go walk away and go for a walk, go for a run. So well-being is really important as well. So when a person says, well, I don't do anything for relaxation, I just study, that is a red flag. And finally, how do you handle difficulties? And resilience is probably the most important thing we look for. What kind of challenges have you had in your life, and how did you meet those challenges? We can teach you the book learning, and we can teach you how to be doctors and nurses and pharmacists once you get into a professional program. What's harder to do is to teach you how to be able to get yourself back up when something isn't working and fix the problem and move forward. And so resilience is incredibly important in health professions. Okay, now, in preparing for the interview, though, beyond just your interpersonal skills and some of the things about you that you might have in your application, there are some questions that you are likely to be asked, and you should be prepared to ask or to answer. You should be able to discuss opinions on current social issues. Okay, we have affordable care. We have health disparities. Minnesota, where I come from, has some of the worst health disparities in the country. That is worth taking note of. What about access to medicine? What about the insurance industry? What about immigration? What about DACA? What about, these are all critically important to all of us who sit on admissions committees. And so we want people to be successful. And so we want you to have opinions about these, but we'll ask you to defend those. Think about the questions to ask the school. Maybe you want to know how successful the school has been in dealing with diversity, equity, and inclusion, for example. Practice, practice, practice is what I would recommend you do as you're really preparing for your interview and you have kind of done all of your reviews and you are ready to really get down into the weeds and getting ready to do your interview. See if you can find a faculty member who's been on the admissions committee, maybe isn't on the committee now, but has been on an admissions committee to do a mock interview with you. And you don't want your mom to give the mock interview, because I'm a parent and I can tell you we're terribly biased. We don't want to inflict any pain in our children. So you want to get somebody who has kind of an outside, neutral type of approach to asking you some questions. Practice in front of others. That's always nice, but also it's kind of nice to sit in front of a mirror and practice in a way that you can see what you're doing and how you're doing it. And if you can, record your sessions. And with Zoom, that makes it really easy now. Be aware of body language and nonverbal communication. I don't know about you, but in spite of my best efforts to try to look like I'm okay when I'm upset about something, everybody always knows that there's something wrong, because I have my husband coming in and saying, "What's wrong? Are you okay?" Even though I'm trying not to be, obvious about it. That's because we're not very good at covering up our body language and nonverbal communication. We just aren't. So be aware of how you come across. Are you dismissive? Are you looking out the window? Do you act uninterested? Are you turning away from people? I'll tell you a story. One of the very first interviews I did in a medical school, I actually did with one of my colleagues, and she was showing me how it was done. And the person that we were interviewing, and both of us were rating this person, he turned his back to me as soon as he saw that the only person asking the question was the interviewer, and totally turned his back. And so you want to be very careful about, even though I don't think it was ever his intent to be rude, it came across that way. So be aware of what you're doing when you're in that setting. And this next item I think is really important. Select and wear the outfit you intend to wear for interviews. I don't know about you, but getting all dressed up, especially after we've been wearing sweatpants during Zoom, right? We've been all comfy, and probably some of us have put on a few pounds. It might be very uncomfortable putting on a suit and tie if you're a man, or putting on a dress if you're a woman. And so you want to put on the outfit you intend to wear for the interviews, just so that you can kind of gauge how it feels. And I actually think that when I get dressed up, I act differently than when I'm in sweatpants, to be honest. And work to develop an appropriate professional demeanor. You're going to sit up straight. You don't slouch in your chair. You're going to answer questions. You're going to, communicate with your interviewer, and you're going to act interested, like this is something you're taking very seriously. And for goodness sakes, please turn off your cell phone. This is a real touch point. It hasn't been as much of a problem in recent years, but you will often go into an admissions office and they will give you some preliminary information before you go out for an interview. And staff members, don't ever be rude to a staff member, and don't ever dismiss them and what they're trying to do for you. We had one person who just sat on his phone, and he was working on his phone, looking at his phone, while my staff member was trying to show the people the curriculum. And she turned to him and asked him to turn his phone off. And he acted like he had never been asked that question before. So be aware of the people around you. And that's what I mean by remember that you're on all the time when you're at an interview. Okay. People are watching you, and people, if there are off comments, or if people are concerned about a person who's come through their financial aid office, or, the opening reception office, they may say something to the deans of admissions. So just be aware of that. Okay, now during the interview, so you're there, you're in your nice clothes, you're sitting up straight. I'm going to encourage you to have one of those meditation deep breath type moments and try to relax and control your nervousness. And I know that that's easier said than done. I think if you have done a lot of interviews, it's easier to relax. If this is your first interview, it's always harder. And trust me, as an interviewer, I never hold that against somebody. I understand that people have different levels of anxiety and nervousness about an interview. But this is your chance to shine. And what you want to do is make sure that you can still control that. So practice, if you tend to be nervous speaking in front of other people, practice answering questions with a colleague or with a friend. Be attentive and up. And what I mean by that isn't that you have to be really perky and crazy wild in your interview. Some of you are introverts, but you have a lot of really important things to say. It doesn't matter if you're an introvert or an extrovert. Just act like you care and that you are an active participant in that interview. Listen and give thoughtful responses and respond appropriately. And by that, I mean, don't just say yes or no. That will make a 1-hour interview very hard for the interviewer, but rather, and also don't ramble. So don't go on and on and on and on and on. What you're likely to have happen if you ramble is that someone will shut you down because they are trying to work through different kinds of categories that they're going to have to assess you on. So they're going to cut you off in that. So you want to be careful to be thoughtful of the answer it, not be too brief, but also not ramble. And it is important for you to emphasize your strengths. And there's nothing wrong with that, but you also need to be aware of areas of concern. And in fact, one of the questions I ask people is, what are several things that you'd like to improve in yourself? What are the things that you'd like to do better? And most people, including myself, have a long list. So we can pull all kinds of things off that list. But there's an occasional person that just hasn't really thought about that. So you'll want to think about that. If you're not sure about a question, take a moment to think about it. You're not in a hurry. You want to be able to think it through. Don't exaggerate. Be honest about who you are. You're going to be at a school for 4 years. You want them to know who you are, and they want to know who you are. So be very honest about any concerns you have or things that you see as areas where maybe you're going to need some improvement or some help. Don't try to tell them what they want to hear. I'm in a mission-based school. So if you come in here and say, oh, I want to meet this mission here in rural Minnesota, I will believe you, but I'm going to look for things that show me that you have done your homework and that you've actually done things that move you in that direction. And I'm also going to let you know that our program has a lot of things built into it that will take you into rural and tribal communities, which means that you will be out there. And so if you aren't interested in that, that's not going to be much fun for you. So be honest about what your interests are. Be honest about what your goals are. And ask any questions that you may have prepared ahead of time or that come up during the interview. Feel free to do that. And after the interview, thank the interviewer. And I don't think I've ever had anyone not thank me. Many people send a thank you note, and I always get the question whether or not it's okay to email a thank you. Yes, you could do that, but it's nicer, and especially since many of the people on your admissions committees are older faculty, it's nice to send a thank you note. So a hard copy, just send it to the admissions office and direct it to the particular faculty member. Take advantage, please, of opportunities to tour a school and to talk to students. I tell people that the best source of information for what really happens at a school comes from the students. What do you like about the experience? What don't you like about it? Is it what you thought it was going to be? Would you recommend this to your sibling if they were interested? Reflect on the interview afterwards and ask yourself what went well and what you could have done differently. And by this, I'm not asking you to second guess. That will drive you crazy. But just from a 40,000-foot level, ask yourself, did that go well? Do I know, pretty much how I did in that interview? And the final thing here, I can't emphasize enough, but if you feel that there was something about an interview that was inappropriate or concerning, I said on here, you or your advisor could call the school admissions office, but I would encourage you to do it because you were the one that received whatever kind of concern that you have, and you want to be able to explain it. And we usually will give another interview to somebody if they feel like that there was something biased in the interview that they had. And this can be accommodated. It really can easily be accommodated with Zoom, right? And with the virtual interviews that we're doing now. Okay, and in this final part of my talk, I just want to briefly touch on multiple mini interviews because this is going to be something that many of you are going to encounter. And it's a way for schools to get insight into things about an applicant that may not come through in their application. So it's looking at social cognitive competencies, which is a big line of words. But it's really looking at things like ethics, your ability to work in teams, your ability to communicate, your ability to critical think and problem solve. And if you're in a mission-based program that you're doing your interview, you might get an assessment of something specific to that particular program that's unique to that program. So the MMIs have been very good in doing that. The mechanics of it is that there's a scenario posted outside a door, and you come up to the door and you face away from the scenario and away from the door. And when the timer goes off, you turn around, you have several minutes to read it and prepare a response. And then you go in and discuss your response with the evaluator. These are pretty quick interactions, so you need to stay very focused. You definitely don't have time to ramble. And you should ask at the end of it whether there are any follow-up questions. Each station lasts about 5 or 8 minutes. And you should understand that there's no right or wrong answers. Oftentimes, with ethical dilemmas, there might be questions that are gray zone questions. And by that, I mean, it's not a black and white issue. It's something that will cause you to pause. And the example I always give is, would you ever steal a loaf of bread? And most people would say, well, I don't steal. I don't steal. But what if I had children and they were starving and I had no other way of getting food for them? What kinds of things could cause you the tipping point of you to do something different? And those are really kind of interesting discussions. And then you have several minutes between these stations, and maybe there's as many as 10 stations or so, for you to get ready for the next station and for the evaluator to write up their response. And I just want to mention here with the scenarios that are encountered, there's the discussion type that I just described, where it's you and an assessor, and the assessor is going to rate you on a rubric. But there are also other kinds of sessions which are kind of fun. There's a collaboration session where you have 2 applicants that have to do a team task, and your assessor is going to observe them and and rate you. And the example I give is that you have 2 applicants with a wall between them, and the applicant on one side is going to describe how to put something together with Legos to the other person without being able to see them and just looking at a Lego set in front of them. This is a really fun thing to watch because usually people get the giggles. Usually it gets kind of funny and they start, and what they end up with is something completely different than what they should have come up with. And it's really kind of fun. There's acting station types where you might have somebody who you're told that person is going to be a resident and that person is homophobic, for example. And you are going to have, you have observed them doing something that is situationally incorrect and inappropriate. How do you handle that situation? So you have an actor, you have an applicant, and you're going to have somebody rating you. And those are really interesting sessions. I'm always impressed with what students come up with or applicants come up with. And then you also can have debates between two applicants. As daunting as this might seem to some people, most of the time MMIs are so much fun and students love doing them. And so I say, how do you prepare for them? Go online, look at sample questions, and have a few cornerstone experiences for things like, what are ethical dilemmas that you've encountered in your life that you could talk about? How do you handle conflict and basic conflict mediation techniques? Are you the accommodating type, or are you the person who's in denial and says, oh, there really isn't a conflict here, let's just move on? Very different ways that people handle that. Read through some sample questions and just think about how you'd answer them. And also be willing to talk about how you work on a team, because most of health professions now are team oriented and are interprofessional. And finally, I just have a couple of scenarios in here that I'd give you as an example of an MMI. If you turned around and read the scenario on the door, the first one is, consider a mistake you made in the past and had a significant impact on another person. How did you handle this situation, and what would you do differently now and why? This is assessing conflict resolution, self-awareness, communication skills, and responsibility. Another one that's a little more complex, which is a problem-solving one, is one where you're going to have to think it through and defend your answer. So due to the shortage of physicians in many rural communities, it's been suggested that medical programs give preference to students who are willing to commit to a 2 or 3 year tenure in an underserved area upon graduation. Consider the broad implications of this policy for health and healthcare costs. For example, do you think the approach will be effective? At what expense? And discuss this issue with the interviewer. Okay, and that's problem solving and communication skills. So those are the kinds of things that MMIs will tap into. That's a little bit different than maybe what you've put in your personal statement. They go a little bit deeper about you as a person and how you work with others, how you think about teamwork, and how you think about problem solving. And most of all, last but not least, I'm just going to say, have fun in your interview. And I have to say that most of the people that come, they're a little bit nervous when they first arrive in admissions. And towards the end of it, they're laughing with the students, they're talking about things, they're going on tours. And I think it's an opportunity for you just to relax and really evaluate a school and see if it's a good fit for you. And that's critically important. And so with that, thank you so much for your time. And I will take any questions that you have, and I'll have Angela help me with that. Thank you.
Well, it looks like we have a couple great questions in our Q&A box. So why don't I read those out and you can feel free and answer them. So if and when the pandemic eases out, do you see schools switching back to in-person interviews, or do you see schools continuing to use Zoom?
That is an excellent question. I can only speak for our school. We did something unique this year. We did not require MCAT, and we went to virtual. So it was all virtual. And we did that, of course, out of necessity. We are going to be doing that again this fall, even though we are now back in person in classes in Minnesota. We just got a mask mandate, so things could change, at any time. But here was the plus that we saw. And two things I want to share with you. One was that a lot more people who probably would not have had the resources to apply to our program applied to our program, and we like that. I can tell you, as a person who teaches medical students too, students perform better on on my exam questions after asynchronous Zoom modules instead of in person. So there were a lot of things that we did better when we did Zoom. And so the idea of we're just going to switch back to the way it was, I would say we have to be very thoughtful about that. So that's a great question, but it's something that I think is we should think about the things we learned with Zoom and all aspects of how we worked in the medical school.
Another question we have is, what would you avoid adding to your application? Would you mention mental illness, perhaps?
That's a really good question. And I will tell you that people share a lot of things with us during interviews. They may or may not have it in their application. I want you to know that many of us, I will tell you a personal thing. During the pandemic, I started seeing a counselor. It was that hard. And I want you to know that faculty understand that mentally we have tipping points, all of us. So I'm sharing that with you broadly, and I have no shame in that. I think sometimes we need to know when to reach out for help. And so you can share whatever you want in your application. Let me put it this way. You might be asked questions about that. And maybe a school does hold it against you if you say that you've had problems with mental health issues, with anxiety and depression. My question back to you is that a school you want to invest in? Is that a school where you want to go? Personally, I think health professions are very difficult places to be right now. And I would hope that we all embrace our ability to get help and to get whatever help we need and to reach out when we are struggling.
Great answers. Another question I have is, how would you recommend researching and preparing for those questions about the U.S. healthcare system?
Oh, that's a really good question. I'm afraid many of us use Dr. Google way too much. But the internet has a lot of information on it. And also, you can go to the Affordable Care Act. You can go to websites and look those things up. I would be very careful with social media sites. There's a lot of misinformation that's being distributed on those sites. It's alarming, especially with this uptick of a new Delta variant in our COVID virus. But there are good sources of information out there from the government too, and not necessarily promoting something, right? Because we have people for and against something like affordable care. But there are a lot of articles on things like single payer. You know, should we expand our Medicare beyond people in my age range out to people in your age range? So, you know, how should that be handled? There aren't right and wrong answers to those questions. Those are opinionated questions, but you might be asked to defend whatever you come up with.
Fantastic answer. Kind of in the same ballpark, could you give us an example of a controversial question? You had mentioned controversial questions earlier.
Something that might be a little more controversial might be an end-of-life issue, for example. Do you believe in assisted suicide? You know, just assisted suicide or end-of-life type of care. Back in the day when I was applying to schools, it was the abortion issue. It was the choice issue. Do you believe in a woman's right to choose? That was a very common question. And now it's kind of moved to a more broader issue of, you know, if a person refuses treatment, if a person goes to a state that has assisted end-of-life care, how should we be expanding that in this country or not? Do you believe in that? So many things get wound into that, like our religious beliefs and our social and cultural beliefs. We have many things that factor into how we answer those questions. And so it may be controversial, but I'll tell you in a nutshell what we're looking for. I don't care if you have a different opinion, but I do care whether or not you're flexible enough to accept me for having a different opinion. So think about that. If you are dead set on, I expect this patient to do what I tell them to do, then that's not being flexible, and that's not letting your patient have the final say. And so those are the kinds of things we're looking at. I respect the fact that people have different opinions as far as whether they believe in a particular type of healthcare or not.
Perfect. And then I see another question here that's kind of similar. And how do you avoid becoming overly political?
I don't. I just go home and yell at my TV. I'm not sure that I'm going to be able to help you with that one. I think you have to be a little bit careful. So many things are politicized now. I'm a woman of science, and I am also a religious person. So, but I'm mortified by some of the things that have happened in the last couple of years. And so, do I talk about that? No. And I don't, because beyond all of you in my Zoom box, because I respect the fact that our country is great because we all have different opinions and we are entitled to those. But when you start going down the road of, I definitely feel a certain way because of, XYZ, again, I'm going to take you back to flexibility. You can have whatever belief you want in something, but if I come to you, let me give you an example. I have a student that did not believe in any kind of reproductive choice with women, and I said, I think, okay, that's fine. You have that choice. But what if I come to you and I'm in a violent situation? I have a husband that is beating me, and I am worried about the safety of my children, and I'm also worried about getting pregnant again. And you're telling me that you can't help me with birth control, okay? Or you can't help me with those things. I challenge my students to think about who they're serving and first doing no harm, and how they're going to deal with that dilemma. Because they're going to have to help that person. They're going to have to get beyond their own personal beliefs and move towards what is available legally and safely to these people. And so those are the kinds of things that get a little bit testy with people, and they can get very political with people, but they also are things we should be talking about in our society. I'll just put that out there. We need to have these conversations. And so anyway, that would be my answer.
I think that's a perfect answer. I feel like our chat agrees also. So really happy we were able to ask that. Well, that is all the time we have today. Dr. Robin Michaels, I know we had a lot of questions in the chat, and if you feel comfortable, maybe leaving your email so students can ask you more questions.
I would be very happy to do that. Let me just put it in here right now to all of you.
Well, thank you for having this session. I know it's kind of a rainy day in Minnesota today. I don't know if it's the same in Duluth, but it is in the Twin Cities. So
yes, very much.
Enjoying some cloudy weather from like the heat storms we've been having. Feels like.
Yeah. Well, it's such a pleasure to get to talk to all of you. Thank you so much. And I wish you the very best. Always reach out to us. It doesn't matter if you're going to be applying to our program or some other program. Many of us do conferences across the country, and our job is to make sure that all of you get to where you want to be. So never hesitate to reach out and ask. No questions are small questions.
Amazing. Well, thank you so much. Students, stay tuned for our next session, which will be crafting your personal statement accomplishment story.
Okay, bye-bye.
Bye.